If you have a torn meniscus in your knee, you may have been told you need surgery to trim it. Before you decide, here is something worth knowing. Researchers did a careful test. They took patients with a degenerative meniscus tear and split them into two groups. One group got the real surgery. The torn part was trimmed away. The other group got a fake surgery. The surgeon made the incision, but did not actually trim anything. Then they followed both groups for years, and the result was the same pain, the same function. Even 10 years later, the group that had the real surgery did no better than the group that only thought they had it. Think about what that means. If cutting out the tear does not help, then the tear, by itself, is not what causes the pain. So what is really going on? The meniscus is a ring of cushion inside your knee. Its real job is to spread your body weight across the joint, so the pressure does not land on one small spot. The problem is not simply that it is torn. The problem is that it has stopped doing that job. It has lost its function. And once you see it that way, everything changes. Cutting the tear does not restore the lost function. So instead of chasing the tear, the better goal is to control the pain where it actually comes from, and to protect the joint from further stress. This is why two people with the very same tear on their scan can be completely different. One has severe pain, the other has none. The tear is not the whole story. What matters is the function, and how the knee responds. So if you are told you have a meniscus tear, do not panic, and do not assume surgery is the only answer. Ask what has actually been lost, and how the pain can be treated at its true source. I explain all of this in much more detail in my other videos. Thank you for watching, and take care of your knees.